I feel strongly that I do recommend people to take on the residency because it adds on another year of your experience. You get to see a lot more specialty procedures such as surgical extractions, endodontics, especially molar endos, where you kind of had to scramble to find during dental school. You also get to talk a lot more with faculty about their different experience in private clinics, DSOs, and kind of gives you a little bit more time to choose like which pathway you want to go to, as well as with additional experience and doing the procedures, you can build up your speed as well.
The residency can be a really good transition between the dental school experience and then independent, confident clinical practice. So we generally start our residents off with just a couple of patients a day, not that different from dental school, but by the end of the program, the resident is going to be seeing the same schedule as our staff dentists see, and they're going to be really confident that they have a sound basis to make clinical decisions on their own. They'll also know that their work efficiency is going to let them work at a productivity that could be sustainable in a private practice or a DSO, wherever they'd like to go.
Yeah, I think residency offers us the opportunity to kind of really get the experience that we want, because school gives us only so much time to get the didactics, the curriculum part down, and then you get 2 years working with patients, but there's a vast, wide knowledge base that we need, and then you need the clinical experience to kind of back that up. So residency kind of bridges that gap where we get to work with mentors and see their experiences and learn from them, but also have the opportunity to work on patients and learn that experience. And I think that COVID aside, residency is always a good idea, but with the last few years being affected heavily by COVID, less patients, less time in school, all those things, that I would highly recommend the residency to anyone who would ask me for that.
The residency is also a really good opportunity to expand your comfort zone a little bit. So in dental school, you get exposed to a wide variety of procedures, but it's really only kind of an introduction. It might be hard for you to go ahead and do those procedures on your own, especially if you're the only clinician in that day, and maybe those types of procedures were always referred to specialty when you're in dental school. So if a resident comes to a residency program, you could take advantage of the experience of the faculty to try to treat those more complex cases and challenging procedures safely when you have that experienced faculty member to back you up. Faculty mentorship in our AEGD program is really an equal relationship where we're learning from the residents as they're learning from us. We have a lot of clinical experience that we can draw on, but residents have a lot of really up-to-date knowledge from dental school, so the learning always goes both ways. Our faculty have a wide variety of clinical backgrounds. There are some that have done more work in private practice or a DSO, others that might have worked more in a pediatric setting and have seen a lot of kids and have some special needs expertise. So what we like to do is if a resident shows interest in a certain area or even feels like they just need more practice in a certain area, we can seek out those kind of cases that are going to meet that need, pair that resident up with the faculty who has expertise in the area, and have them work together as a team to see the patient.
HealthPoint does a really good job with mentoring us and kind of building a curriculum for the residents. Dr. Terabitz works really, really hard to make sure that we start from, July 1st when we start all the way till June 30th, that we're kind of building, improving, getting faster, and she's always there for us. The other faculty are amazing as well. They're always available whenever we need them, their experiences, and we always feel equal with them. From the beginning, day one, they're always like, what do you think? What is your experience? What would you recommend? And that really helps build a really cohesive team environment.
One thing that I would tell an applicant applying to residency is to be curious. Take that challenge and broaden yourself and stretch yourself, because residency is going to be difficult, but in a good way. You start off in a safe space where the attendings, kind of help you crawl you through it, but by the end of it, you learn how to fly and you learn how to be very independent and have that confidence there. So that's the biggest takeaway, again, is that residency is not only you broaden your knowledge and your skill set, but you also gain that confidence that goes a long way.
For more information about the NYU Langone Dental Medicine AEGD program at HealthPoint, you can go to our website, navigate to Join Our Team and Educational Programs. We have sections about our AEGD program as well as our other learner programs, and more information about HealthPoint as an organization. There's also a section that talks about our area of the Pacific Northwest and includes video tours of some of our clinics. Another source of information would be the NYU Langone Dental Medicine website, or if you can't find the answer to your question, you can email me here at HealthPoint, and I can answer your questions as well as provide a Dropbox link with additional information about our program and site.